Kids do get seriously sick from COVID. It's less common than adults, that's for sure. They have a milder course than adults do, but it's actually worse than the flu. And we here at UW Health, we've seen some significant hospitalizations, some children in our ICUs. And reports we're getting from around the country right now during this Delta outbreak is that down south, many of the pediatric ICUs are quite overloaded with children who are sick. So masks do work. They're not perfect, of course. We all pull our mask down every now and then, but we do know masks are very effective in preventing COVID. There's plenty of data. It's available on the CDC's website on how well masks work and what they do to prevent spread of COVID. So masking can help schools stay open by really helping us decrease the amount of quarantine that we need to do. That we have to pull fewer children from school if they're masked. Because if a child is masked and they have an exposure to somebody with COVID, they don't need to be pulled for a 10-day quarantine period, a 10 or 14-day quarantine period. They can stay in school as long as that child has been masked. The vaccine was very well studied in teens. We know there are some rare adverse events that can happen in the teenage population, but overall the vaccine is very safe and effective. And I would not hesitate at all to give the vaccine to a teenager. So the process for approving vaccines under the EUA is basically identical to how we would do it during regular times. The difference is we were able to accumulate a lot more children very quickly for that study and for the adult studies as well. So the safety issues, I think, are quite well established with these vaccines, and they are a safe and effective vaccine. There have been a number of articles out there about the potential adverse effects of masking. There was a large study that was actually recalled or retracted because it wasn't up to scientific snuff that purported that CO2 levels increase in masking. We know that people wear masks all day long. Our surgical staff wear masks 12 plus hours a day. We all wear masks here at UW Health most of the daytime. And children are able to tolerate masking quite well without evidence of any low CO2 levels or low oxygen levels or anything like that.